So with the medication, it's a once weekly injection. You usually buy a month at a time. Ozempic is the cheapest, but Ozempic is not designed for weight loss. Ozempic is a treatment for diabetes, and one of the side effects of it is that it can help patients lose weight. So it's very difficult for a non-diabetic obese patient to get access to Ozempic, but it is by far and away the cheapest, and it's around about $150 a month. Wegovy is the only medication that's specifically designed for weight loss. It's not for diabetics, Wegovy, it's designed for weight loss, but it's $400 a month for those injections. So if you look at it for a year, a proper medication for weight loss like Wegovy is about $5,000 a year, and that has to be paid for the rest of your life. I'm sure though the costs of the medication will come down in the future as other companies make an equivalent to Wegovy. The costs will come down. Wegovy is charging way more than Ozempic at the moment because it's unique. It's the only one that is available for weight loss. But once other companies have their product on the market, I'm sure the costs will come down. For the patients who have health insurance, the out-of-pocket costs for surgery is between $3,000 and $8,000, depending on the type of surgery, previous history of surgery, whether it's a redo surgery, and whether there's other surgeries on the inside that have to be performed at the same time. For uninsured patients, the cost out of pocket is about $3,000 to $8,000 for the surgeon and the anaesthetist costs, but there's also the hospital costs of around $20,000 for the surgery, which Medicare won't pay if you don't have health insurance. There's a number of studies, and in Sweden's a unique country in that you cannot perform surgery unless you contribute to the surgical registry. So every surgeon in Sweden and every surgery that has been performed goes into a central database to look at the surgery, and it's to make sure all the surgeons are reaching a certain level of competence. There's no outliers, and not just with weight loss surgery, this is with every surgery across the board in Sweden. And there's a very famous study called the SOS Study, the Swedish Obesity Surgery Study. And they not only looked at the complication rate and the results of each of the surgeries, but they did a real detailed analysis of the costs of surgery. And the SOS study found that no matter which type of weight loss surgery you had, the weight loss surgery recuperated the costs associated with the surgery within 3 years of having the surgery. So what they were saying is that the amount of money that cost to have the surgery was saved by the health industry in Sweden, because the patients who had the surgery had less medication, less visits to their doctor, less hospital visits, and less GP visits. So in actual fact, that study, which was, as I say, a countrywide study, shown that having obesity surgery pays for itself within 3 years.